So this video, we're going to be talking about the endocrine system and the integumentary system. We'll start with the endocrine system, and it's a body system containing glands. These glands regulate growth and also control other important activities in the body through the production and release of hormones. As I said, these endocrine system is made up of glands. These glands release hormones throughout the body. The glands are located at various parts in the body, and the hormones they release are responsible for various body functions and changes, and they are especially active during adolescence or puberty, as you might know it. Glands are made up of cells, and as I said, these glands are located throughout the body, and each one produces a hormone and has a specific task. Hormones are chemical messengers produced by the glands to carry out the body functions. We'll hit some important glands here, and the first one is the Godfather gland. That's kind of the nickname of it. The actual name is the pituitary gland. The pituitary gland is located in the base of the brain, and it produces hormones that control other glands and organs. It also regulates the body's growth and development. The next gland is the thyroid gland, and it's located in the front of the neck. The thyroid produces a hormone that regulates the speed at which your body turns food into energy, and just like the pituitary, it also helps regulate growth. The next gland is actually a pair of glands called the adrenal glands. They are located on top of each kidney, and like the name suggests, these glands produce adrenaline. You probably hear adrenaline when you're playing sports or when you're faced with a certain stressor. Adrenal glands also play a role in digestion and help maintain the balance of salt and water in the body. The next one is the pancreas. Pancreas is located behind your stomach, and it produces insulin, which controls the ability of body cells to use sugar for energy. The final one we're going to talk about are the ovaries and testes. These are the reproductive glands, of the male and female. They produce the male and female sex hormone, which controls sexual development. Males will produce testosterone, and the females will produce estrogen. Some problems you might run into with the endocrine system are multiple and many, and they can affect the body pretty bad because they control organs. And if organs can't do their job, then we are in some trouble. Usually the diseases of the endocrine system develop when there is either too much or too little of a hormone produced. So an example of one is diabetes. Diabetes occurs when the body doesn't produce enough insulin or doesn't use it properly. Insulin lowers the amount of sugar in the blood. People with diabetes will have too much sugar in their blood. There are two types of diabetes, type 1 and type 2. Type 1 diabetes occurs when the body produces cells that attack the pancreas's insulin-producing cells, causing the body to not produce enough insulin. People with type 1 diabetes must regularly inject themselves with insulin to keep their blood sugar at the right level. Without treatment, there would be too much sugar in the blood, and they could slip into a coma. Actually, they would slip into a coma with too much sugar in their blood. The next type is type 2 diabetes. This is where the body produces a normal amount of insulin, but the body can't use it correctly. This type typically develops in adulthood, but within the last 20 years, we are seeing a sharp increase in juvenile or type 2 diabetes in kids. This is obviously due to the poor diet and lack of exercise we have. It's more common in overweight people. These people tend to feel tired a lot and are often sick to their stomach. They may also have infections and wounds that don't heal. People with type 2 diabetes have to carefully control their diets and engage in regular physical activity and may also need medication. If you don't manage diabetes, some long-term effects could include poor circulation, nerve damage, heart disease, kidney failure, blindness, or amputation of limbs. So it's obviously a disease you either want to manage or not get if you're able to. Another endocrine disease is thyroid disease. This is where it's kind of messing with your metabolism. And if the gland doesn't make enough hormones to regulate metabolism, a person can develop a condition called hypothyroidism. A person with hypothyroidism may feel tired and cold, have dry skin, and gain extra weight. In teens, hypothyroidism can also delay growth. Fortunately, it can be treated with a thyroid replacement hormone. There's also hyperthyroidism, and it's the opposite of hypothyroidism. In hyperthyroidism, the thyroid produces too many hormones. This leads to a very high metabolism. A high metabolism can lead to sweating, excessive eating, weight loss, tremors, and muscle weakness. And just like hypothyroidism, hyperthyroidism can be treated with medication. We're going to move on to the integumentary system. This is a very long, fancy word to pretty much just say your skin. It's the outer layer of your body. Your skin is the largest organ in your body, and it's an outer barrier that protects you from germs, regulates body temperature, and allows you to feel and sense pressure and temperature. It's made up of 3 main layers: the epidermis, the dermis, and the hypodermis. We'll start with the epidermis. The epidermis is the outermost layer of skin. It's made up of dead skin cells that act as the initial barrier. They are completely replaced about every 4 weeks. These cells will slough off in the shower, while you sleep, just through normal wear and tear. There are no nerves or blood vessels in the epidermis, so the scratching, the sloughing off of cells won't hurt, you won't bleed. Some of you may have experienced where you kind of lightly scrape your arm and you just get that kind of white streak across your skin. That's just you sloughing off a little bit of your epidermis. Now, if you get into the second layer, the dermis, it's thicker than the epidermis, and it's made up of live skin cells, and it does have the nerve endings and the blood vessels. So that's when you bleed or when it hurts. It's because you've gone through at least the dermis level. The dermis also contains your sweat glands and your oil glands and your hair roots. So this is the deeper layer of skin where you'll start to see more glands and vessels and nerve endings. The deepest layer of the skin is the hypodermis, and it helps insulate the body and cushion internal organs. So it's pretty much a layer of fat that keeps temperature in, lets temperature out, just kind of regulates, and also cushions your internal organs. We obviously don't want to hurt them. We want to keep them intact. There's some diseases of the integumentary system you probably all know and are dealing with currently. Acne. Acne is caused by overactive oil glands, and this is due to increased hormone production during adolescence. Gotta love puberty, boys. Their excess oil clogs the pores and causes bumps on the skin surface. You might know them as pimples or zits. You can help control acne by washing your face with mild soap, but don't scrub too hard. And avoid popping those pimples, as tempting as it might be, as they can leave scars on your face, and they can also spread the bacteria that formed in the pimple to other parts of your face, thus causing more pimples. And we all know we're trying to avoid those pimples. Another one is skin cancer. Skin cancer is caused by overexposure to the sun, especially unprotected overexposure. So it's a good idea to wear sunscreen when outdoors. Make sure to reapply frequently, and wear at least SPF 30, and be sure to follow application directions. Too many times people will put sunscreen on at the beginning of the day. They'll go swimming, they'll play around outside, they never reapply, and they end up getting a sunburn. And too much of that can lead to skin cancer. So make sure you're putting your sunscreen on, you're rubbing it in, and you are reapplying. The next one we'll talk about is eczema. Eczema is also known as dermatitis. Eczema looks like red, itchy, flaky skin. It can occur anywhere on the body, and sometimes it happens all by itself, and other times it is caused by outside factors, such as poison ivy or an allergy that you didn't know you had. Dermatitis is best treated with a topical anti-inflammatory cream and ointment, and topical just means you can just rub it in your hands. And for mild cases, some over-the-counter medicines work well, but a prescription may be required for more severe cases. That is the endocrine and the integumentary system. Obviously, if you have any questions, you can see Coach Wag. He'd be more than happy to answer them or go in more depth. But these are the 2 systems that we will be talking about in this video. Thanks, and have a great day, and don't forget to do your check for understanding.